This is the most requested video, the kind of jobs that you can do with public health. What are the things they teach you in school? Public health is an umbrella course. It's not the escape course. Do what you deem fit with the information I brought to you. Hi guys, welcome back to my channel. It's your baby girl again, MonnyLagos, and I'm here with another exciting video. You know the vibe already. I'm so excited to be filming this video because literally this is the most requested video. Like, I'm not going to say one of my most requested videos. This is like the most requested video from you guys, like Instagram DMs, emails, even on Snapchat. Some people are texting me, please, when are you going to release a video about public health? And here we are today. Yeah, if it's your first time stopping by here, my name is Muninola. Make sure to subscribe before you leave, and if you're a returning subscriber, thank you so much for always coming back to watch my videos. Yeah, we're finally doing the video about public health. We're finally doing the video about public health, and I promise you guys I have a lot to talk about, so get ready. This video is going to be very long. Like, okay, not very long, but it's going to be long because I'm trying to explain things to you guys, and then I'm trying to be clear on what I'm saying. I don't want to say things halfway and leave it halfway for you guys. So I put up a question tag on Instagram asking you guys to send me questions about public health that you want to know. I'm going to be answering them in this video. I'm first going to tell you guys all I want to say, and then I'll go to the questions, and whatever I've not answered during the course of the video, I'm going to answer it again. So first of all, I want to put out a disclaimer. This video, first of all, is not in the light to scare anybody. I'm not here to discourage you from doing the course of your choice. I'm not here to tell you the course to study. I'm not here to tell you do this course, you're going to get a job, and I'm not here to tell you do this course, you're not going to get a job. I'm just here to tell you, based on my own experience, what I've seen, what I've heard from my friends and people around me. Now, if you're a public health person here and you had a different experience to what I am saying, it will be very much appreciated if you can put down your comments, but please put it in a constructive way. If you come for me, I'm going to come for you big time. I'm not even joking, because I'm here to talk about my experience, and this is the reason why I've stalled on this video for so long, because I don't want anybody coming here to tell me jack shit. With all that being said and done, let's get right into it. So first of all, I'm going to want to tell you guys what public health is. So basically, public health is literally health of the public. That's like the layman, what's it called, definition. That's what public health is. Public health, health of the public, health of the people in the community. Now, what we do in public health is we try to educate people about their health, how they can prevent certain diseases. Now, we're helping people prevent and know about diseases before they get the disease and then take it to the hospital. So literally, public health is a way of reducing workload on the other healthcare workers in the hospital. So basically, what the public health official would do is, go into the community, educate people about their health, educate people about their surroundings, how they can keep themselves safe, how they can, avoid these diseases and all this kind of illness around. So basically, as a public health official, you're like, you're speaking to the people. You're like the what's it called, the educator of the people before they get to the hospital to know things about themselves, which is like very important, right? Yeah. So in UK, yeah, most public health schools in UK offer. I'm not going to come here and tell you guys the schools that offer public health. If you want to know the schools that offer public health or that you can study public health in, all you need to do is go to whatuni.com. I'm going to put it on the screen here, and it's also going to be in my description. Go to whatuni.com, type your course, and the universities that offer them will come up with their tuitions. Most times, public health in UK is a 1 year course. I've heard about 2 years, but it's very rare. Most times it's a 1 year course, especially when it's a master's degree. It's always mostly 1 year in the UK. And the average of the tuition is like, say, from 10,000 to like 14,000. Like, it really varies on the school. Like I always say, schools inside London are more expensive than schools outside London. So I've spoken about what public health is. I've told you guys how much the average tuition is. I've told you how many years it takes to study it. I've told you how to get schools where you can study public health. Now we're getting to the nitty-gritty, the reason why you are here. So I'm going to talk about the kind of jobs you can do as a public health, like a person that has a master's degree in public health or maybe a BS in public health, the kind of jobs that you can do with public health, right? I wrote them down because I don't know them often. You can be a healthcare quality improvement analyst. You can be an environmental health scientist. You can be a health educator. You can be a research assistant. You can be a health program specialist, a disease investigator, an epidemiologist, and a health consultant. So basically, there are kind of a lot of jobs you can do, but they all still work in hand with what I explained earlier. So I know that the question always comes up as, oh, what courses, like what are the things they teach you in school for MSc Public Health? You're going to learn about social determinants of health. Those are the things that, are in our environment, in our homes, that, determine how our health can be. So that's like one of the main courses that they teach you in public health. Also going to learn epidemiology. That's like that's one of the most tactical courses in public health, where you're going to be doing calculations. You're going to be, literally is a lot of calculation. Epidemiology is a lot of calculations. And most times they ask you to choose between leadership in public health and epidemiology. Most students go for epidemiology because, it broadens your knowledge. It gives you more opportunities as to what you can, do after school. Also, you're going to be doing research. Research is like the backbone of healthcare. Like literally everything that happens, a research goes on about it. Any new disease, they need to find it out. Any old disease, it's just research always goes on. So you're going to be you're going to have courses regards to research, and they teach you how to do research and all of those things. Now, I understand that most times, especially I'm talking from a Nigerian perspective now, because obviously I'm a Nigerian. I came here from Nigeria. So like that's like where I can like draw most of my references from. As a Nigerian that maybe when you're in Nigeria, you tell them, "Oh, I'm coming to UK to study public health." Everybody just automatically thinks, "Oh, because there's health under it, there's health in whatever you came to study, your life is settled in UK," or like, "Oh, healthcare workers are very, very much needed in UK, and so yes, you're going to get a job immediately you finish, your life is settled." I had someone tell me that, "Oh, you're going to do public health. You've started your life out too," like literally. I mean, they're not lying. So here is the thing: there are jobs that are very much needed in the UK, and I'm going to get to that very soon. So there are jobs that are like very much needed in the UK, and as much as the healthcare system is one of the places where you get a lot of job opportunities in UK, it really depends on the kind of job. So the kind of jobs that are like very much needed in the UK are like nurses, the doctors, the carers. Like those ones are like on a high demand in UK. Now, not to now say that, oh, there are no public health jobs in UK. Public health is an umbrella course. Anybody that studied anything that regarding to health, if you're a microbiologist, if you're a lab scientist, if you're a nurse, if you're a doctor, anybody can study public health as long as you have a little knowledge or you have a prior knowledge in anything in healthcare. You can always study public health. I had doctors in my class, I had nurses in my class, I had microbiologists in my class. There were a lot of other fields regarding to health in my class. Now, what I'm telling you is public health is a very broad, sector. And because a lot of people, everybody can study public health as long as you have like a little knowledge about your community, healthcare, you're good to go, which makes the opportunities more stretched. Another thing I'm going to talk about is your reason for studying public health. If you're studying public health because, oh, you just have the passion for public health, you love the course, you love everything that it's about, and you just want to learn about it, sure, by all means, go for it. Like, I mean, it's a good thing. You learn about it, you have the degree. But if your main reason, or if one of your main reasons for studying public health is to stay back in the UK, that's not the course for you. Like, it is not the course for you. I'm going to give you my reasons. If you're coming to the UK, I always advise that you study a course that you've done in your undergraduate. I understand that some of us did courses in Nigeria, or you did courses in your own countries because, oh, you just wanted to do it. But all I'll try to help you understand is what is worth doing at all is worth doing well. If you know that you did like say, well, if you did like say microbiology as your undergraduate course, I would always advise do the microbiology again. It gives you more leverage, it gives you more opportunities than you coming here and then you're doing public health. Because it now gets to the point where you're not qualified enough for them in UK to give you a public health job because your undergraduate was in microbiology, they're not sure, and you're not so qualified to get a microbiology job because they're like, oh, you just did undergraduate and it was not even in UK. So no. Like I said earlier, I'm not saying that this happens to everybody, but like it's easier for people that have, if you know you had a professional course that you did as an undergraduate and you're sure of that professional course and you just want to come and do public health, like the nurses, like sure, if you do nursing, if you did nursing before and you're like very much qualified and you come here to do public health masters, you're just going to be a public health nurse, or you're just going to go back to being a nurse. And then because you have a master's in public health self, you might even get a higher pay. But if you come here with the intention of, oh, you're coming to do a master's in public health, then you will start a career in UK. I'm sorry to inform you, but that is not the case. Another thing with public health is, you remember when I explained earlier that public health is like health of the community. You meet with people. Like when they, before they can employ you in UK, they want you to know the environment where you're working in, especially with public health. You need to know the environment. You can't just come from somewhere and then want to come and work in the environment. Explains why getting a job in public health is really, really very hard for Nigerians that are just coming here. Like you just finish your masters and you want to get a public health job. You go take, you go take. That's not even coupled with the fact that sometimes when you want to apply to these jobs, you see that they'll ask you if you're a member of this community, if you're a member of this association, or the rest, if you have this license. By the time you go and check out to get those license, it's very stretched. You'll be seeing that, oh, you need to do a course of 2 years, that's going to school again. The point of coming here to like get a, to do a what, to start your career is not now feasible anymore. Also, generally, before you can get a job in UK, when they put in these jobs on the, what's it called, on the what's job websites and all of that, a British citizen is considered first before you, that you are, coming from anywhere to get the job. Like it's not them being wicked. It's just a normal thing. It's until when they've searched and they can't find somebody qualified enough to get that job here, that's when they can, now say, okay, let's check this person that is not from here, maybe they can do the job. And in most cases, by that time, somebody else has taken the job. Now, it's very rare. Like me, I'm talking, like I said, I'm talking based on what I've seen. It is honestly very rare. Like out of all the people that I graduated with, maybe only one person has a public health job that I know of. Maybe only one person, to be honest. Maybe only one person. Every other person is doing something else, or still trying to find their ground, or trying to venture into other places, trying to look for other opportunities. So basically, public health is not the, how do I put it? It's not the escape course. Public health. See, you guys, I'm telling you, because most of us, we don't know these things. Like nobody tells you. Everybody comes in the moment you say, "Oh, you're coming to the public health." Everybody's like, "Oh, that's good." Oh, nobody tells you these things. I mean, I'm here to tell you. Me, I don't use myself as an example. I don't do lab rats. Now I don't come tell you now. Don't make the same mistake. I'm telling you again and again, right? If you're doing public health for the sake of, you love the course, that's what you want to do with your life, that's the only thing you think you can do, sure. Or if you have an undergraduate in public health, I promise me, maybe you should come and get a master's degree. It might work better for you than some of us that didn't have an undergraduate in public health. But if you're coming here for the main purpose of, I want common Naija, I want japa, as my people will say, public health is not the cause for you. Before you get sponsored job in public health, whoa, oje my bo, oje oh my bo. I'm not even joking. See, you people, the struggles, the struggles. Just somebody will come now and say, "Oh, how will you talk like that? Why are you discouraging people? Why are you so negative?" But I know that some people, you people don't want to hear the truth. You like the person that will sweet talk you and lie to you. The person that will come to you and tell you the truth, tell you how it is, so that you will not make the same mistake. Una no go hear that one. Now, this is not me saying that I didn't like my course. Honestly, you guys, I love public health. Like that's the reason why I did the course, was not because, oh, it's very much needed in UK. I did it because I like it. I've worked as a public health official. I know how the job is. Like I love it. That's why I did the course. But fortunately and unfortunately, the situation is not the same, or is not what you thought it was going to be. So basically, all I'm trying to say is, because I've heard, guys, I've heard a lot. I've heard people that did courses that are not even related to health, saying that they want to come and do public health just because you heard that, oh, anything in health is a big break in UK. Rethink, if not, you come here and come and do Kiera. Think about it. Think about your options very well. Don't come here and do public health because, oh, you want to japa, and health jobs are on high demand. Know the exact jobs that are on high demand before you come here and do public health, because it's a way to get into health. Think about it very well. Don't come here and after you finish, you can't dey run around. My brother, my sister, I've told you people, do what you deem fit with the information I brought to you. That's all I'm going to say.
I'm sorry for the break in transmission, you guys. Your video will continue very soon. I just wanted to address something on the Amber Student Home website. So obviously, when you click the link, you see that you were recommended by me. Always make sure that is showing because it's very important to me. Also, I've had questions about um, the accommodations I want are sold out, or how do I know if the accommodations I want are sold out? So basically, you type in the location you want. Although, like, I'm very much aware that most accommodations for January are already sold out, but you see it on the list when you type in the accommodation. When you type in the location, you click on the accommodation. When you scroll up, you see the dates when they are available. Like it will be there. Like you can see this one, it says moving for this one says moving for January is already sold out, but the next moving is for September. So this is another like call out for people that are coming in September. Please book your accommodations early, because I've had a lot of people call me or text me about accommodations for January. I cannot help you for accommodations for January at the moment because they are almost all sold out. So as if every one of them is not sold out. I'm typing another city again just to show you guys what I'm talking about. So when you click on the accommodation, you scroll up, you see the dates that are available for moving. That's when the apartments are available. So this one also is saying 2nd of September 2023. So basically for January it's going to be very, very hard to get an accommodation at this time. So yeah, that is basically what I wanted to show you guys. And yeah, we can go back to the video now.
So you guys, the first question that I got on Instagram is, hi Money, please, what's the difference between MSc Public Health and MPH? I have a laptop here, I typed that on. I'm going to read out what I can read here, then I'll give you guys what may I understand as the difference. Now it says that MSc Public Health, that's MSPH, is considered a more academic degree that focuses on research methods in public health, while MPH is considered as a more professional degree for practitioners and may enable students to handle a variety of public health issues. So basically, MSc Public Health, like what may I understand is MSc Public Health is Masters of Science in Public Health. That means that you learned other things apart from just the public health. Just the that's where the epidemiology comes in, I think. Then for MPH is Masters of Public Health. That's literally you're doing public health, and that's what you're doing. You're literally just learning the whole social determinants, leadership in public health, and all. You're not learning the scientific part of it. So that's the difference I know. Next question is, can I work with WHO? Yes, of course you can work with WHO if there are like what's it called? Um if the job requirements relates to what you have, like if they say, oh, the person must have a master's in public health or a degree in public health, yeah, sure, you can work with WHO is like they're like one of the main people that do like main organizations that make public health like what it is today. Next question is public health a criteria for tier 2? Public health is not a criteria for tier 2, like I've said before. It is not. This is a 1% out of 100% chance. It's not a criteria for tier 2. If you're lucky, you get a job that's a public health job that wants to sponsor you. But most times, they always want somebody that knows the community, so it's a bit stretched. How is the job market for public health graduates in UK? I think I've answered that question already. It's yeah, I've answered it already, and that was when I talked about the whole in the community. And of course, yeah, an international student just came into the country last year and you did your master's degree. You cannot claim to know the community where they want you to work. And coupled with that is the whole is the associations they want you to belong to, that as a master's degree holder. You're not told about those in class. They don't tell you that, oh, you can register to these communities, and they don't help you to register to the organizations. It's after you finish and you're reading job requirements and you're saying that you need to be part of a community that you're not. So yeah. What's the difference between this is another question? What's the difference between MPH and Masters in Public Health? I've explained that before. Public health and social work, are they the same thing? If not, what's the difference? Public health and social work are not the same thing. Public health, I explained what public health is already. I'm not going to go back into it. For social work is a lot more behavioral. Like social workers what, like they are more, it's more of behavioral aspect of health and not, the general aspect of health. Social workers don't deal with diseases and all of that. They deal with your behaviors, they deal with mental health and all those things. So yeah, it's different. How to get scholarships? I don't know how you can get scholarships, my sister or my brother, whoever asked the question. You can check, when you check for schools, you can check if they have scholarships available. You can apply, but like for me to come and tell you how to get scholarships, I don't know. Even me, I paid my tuition in full. I did not get scholarships, so honestly I can't give you that information. Is there high job opportunities in public health? Like I said, it's relative. There are jobs, like literally I get notifications for jobs every day. I apply to them. There's one thing or the other coming back. Oh, unfortunately this, that, or so there are jobs. I'm not going to say there are no jobs. It's just getting them that is not as easy. How many years is MSc Public Health? I answered that earlier. Most times is 1 year. I've heard I've heard about 2 years. I'm not sure, but most times, most of the public health students that I know that are in UK that are international students, they did their course for 1 year. So yeah. Um, what career paths are available for someone with MSc in public health? I explained that earlier, where I gave the list of jobs you can do as a public health, graduate. So if you didn't get that, maybe go back to the beginning of the video, or yeah, I'm sure you heard it earlier. What would you do after studying it, and how to apply? How many years it takes to complete it? I'm guessing you're asking me how to apply for public health. If you want to apply for public health, you go to the website of the school that you want to apply through. Look at the requirement, look at the documents they ask you for. If you have them, submit them. That's how to apply. It's not that deep. Or you can apply through an agent if you think it's too tedious for you. How many years is it? Like I said, on an average, 1 year for masters in public health. Then what will you do after studying it? I'll give you the list of jobs that you can do. There are lots more than that, but like that's like those are the popular ones. In general, is it really worth it? Like I said, it's really relative. Like it depends on what you want to do with the course. If you plan to do it and go back to your country to work with it, yes, it is 100% worth it. If you plan to do it because you want to japa and come to the country and get a permanent job, think about it. Think about it. I don't know. Except maybe you have the job on ground. I honestly don't know. Are there job opportunities after graduation? I've explained this job opportunities thing. I feel like that's more of the question, but yeah, I've explained it, so I think you get scholarship aspects. I've also talked about that. Do you regret studying public health, and why? Honestly, I don't regret studying public health. I like the course. It's something I've done when I was in Nigeria also. I love the course. Public health is very beautiful. It's a very nice course. It gives you a broader knowledge of, how the environment and your healthcare works. So honestly, I don't regret studying public health. I love the course. I'm still going to use my degree by the grace of God. But yeah, it is what it is. I mean, some things happen. I honestly don't regret doing public health. No, I love the course. A friend of mine is advising me against coming to study it. What are the job prospects? The friend of yours that is advising you against it, I'm assuming that the person also studied public health. If the person is telling you don't come and do it, that means they know you better. They know what you've done before, and so if they're advising you against it, think about it. And some people can just be bad beleo. If you lost the course, like I said, come and do it. But if you're doing it because you want to get a permanent job in UK and you want to move, think about it. Like honestly, if you have another healthcare degree that is not public health as an undergraduate, I think you should do that. It gives you more leverage because when you're applying to jobs, they consider your undergraduate also. It's not only the master's degree. So yeah, if your friend is advising you against it, please think about it very well because, and I'm suggesting that the person also did public health. So yeah, do you think if someone just wants to jackpot, they should go for something other than MPH? Yeah, like I said, if it's for the sole purpose of jackpotting, think of something else. Don't if don't come and do public health for the sole purpose of jackpotting because you do a book. So that's not it. Is getting a public health related job in UK really as hard as people make it seem? They don't make it seem. My sister, my brother, whoever asks this question, it's not a make it seem. I'm in the same situation. It is not a make it seem. It is what it is. I mean, I don't want to. Obviously, it will not be hard for any one of us in Jesus' name. I'm staying positive to that, but it's not a make it seem. It is reality. Like it's what is happening. So nobody makes it seem like something is hard. Like I mean, and if you think you can do it, of course, because I know that some of us will say, "Oh, it's a lie. They are just making it hard." So that nobody said you should not come to UK. Just don't waste your money, don't waste your time. Look for a better course. Like Okay, let me not say better course, because public health is a very lovely course, but look for a course that you know you can work with. I'm not going to, I've said it before and I'm saying it again. Do with the information what you deem fit. Hi, I just got an admission MSc Public Health. Please, where can I work? Huh? Where can I work at the program? I'm guessing you mean where can you work after the program? Congratulations on your admission. Where you will work, I don't know. Honestly, I feel like this person now be so sad watching this video. But it's just the truth. Like it's just the truth. Like do your course, do it, but start thinking of other options from now. Start thinking of maybe it's your undergraduate course you're going to brush up on while you're doing your masters, so that when you finish, that's the one you use and get a job. But honestly, MSc in public health to come and get a job here and start your life. Mm, okay. What does the project entail as an MPH student? Is it like the one we do as undergraduates? Oh yeah, the research is almost the same, but it's a lot more tactical. It's a lot more, how do I explain it? It's a lot more um hey, I'm trying to look for a word. It's a lot more targeted. Public health projects here are, it's just like undergraduate, honestly. It's the same thing. Them qualitative, quantitative, systematic review, but they'll teach you. They'll still teach you again. They'll brush up your knowledge. They'll teach you again here. So don't be scared, you'd walk through that with your lecturer, of course. Please, what are the job prospects of public health in UK? Have you gotten one? I've not gotten a public health job, but yeah, I'm working on it. So yeah, I've talked about job prospects already. I think those are the questions I had. I can't believe I just answered almost 30 questions now. That's good. That's good. That's good. But yeah, most of the questions, if I didn't read out your question, definitely it's a repetition of what I've said before. But yeah, that's all I have for you guys. So yeah, finally we have the video now and you can use it as reference. Thank you guys so much for watching. Don't forget to subscribe to my channel. If you're new here, subscribe to my channel and watch my other videos and my vlog. You're going to love it. And share this video with your friends. Share this video with your friends that you know will need it. This is one of the videos where you need to be sharing. Share this video with everybody that you know that wants to come and study public health, or they're already studying public health, or they want to, just share this video with anybody that you know that wants to come to UK to study public health. They will really, really appreciate it. I'm not even joking. They will appreciate this video and all this information from you. Till I see you again in my next one, babies. Take care of yourselves and have fun. Bye.